Hi, this is Dr. Zachary Ward from Life and Alignment Chiropractic. I'm an upper cervical chiropractor in Auburn Hills, Michigan, and sitting to my left is a Mr. Cedric McSween, and he is an expert in healthcare plans. And there are a lot of people with a lot of questions about what's going to be happening with open enrollment coming up. Literally in just a couple days. We're recording this on November the 6th, 2014. And why we're sitting together here and putting this recording together is because this is just a service we wanted to provide you, because this is a kind of a tumultuous time in health insurance, and it's a decision that's going to affect a lot of people's lives. And we wanted to put some information in your hands that's going to be able to help you make those decisions. And that's going to be information that is appropriate for both individuals and groups. So if you are looking at an individual plan, we're talking to you today. And if you're a business owner and you have group plans, we're talking to you today. We're going to kind of go over the situation for both of those. And then we're going to end with something pretty cool. Cedric's going to talk about cost savings and a few kind of hacks that you can do. So a few tricks that you can do, especially with your prescription med card. You know, I'm a chiropractor. I'm not a expert in prescription medications, but Cedric knows some stuff that everybody's going to want to know. So I'm going to let Cedric introduce himself, and then we're going to start off with some questions. So go ahead, take it away, Ced.
Thanks, Doc Zach. I really appreciate it. Hello, everyone. I'm Cedric McSween, Sr. I'm a licensed insurance consultant in the Troy area. That's where my office is located at. I've been in this business about 15 years, and I started the agency back then. I have multiple carriers that is very important to know, so I don't focus just on one carrier. And that could be Blue Cross, HAP, Health Plus, Priority, Total Health Care, so etc. But that is my main focus, is to service my clients, whether it's a group or an individual plan, with the best program based on their budget and based on the value.
So let's go ahead and talk about then. We'll start off with the individuals. What's happening in terms of time frame?
Open enrollment starts November 15th, and that is giving a person an opportunity to enroll into a health plan, giving them a January 1 effective date. What I would ask, if you don't mind, as I go through this process, talk with your agent and make sure that you're communicating with them as well, and please be patient with them, because in this industry throughout the country, we are experiencing a major challenge right now, because the clients are geared around a January 1 enrollment period now. That means any client that we've enrolled in January, February, March, February, etc., now has to go into a January 1. So that means whatever your book of business is in terms of size, you have to work extremely diligently and time sensitively to try and enroll everybody in 1 to 2 to 3 months period. So that's a big challenge for us.
So what you're saying is if, let's say I was on an older plan and our renewal was in July. Well, I'm coming up again now for this open enrollment period starting November 15th with a January 1 effective date. And that means everybody for the entire year.
Everyone, that's right.
So rather than processing 500 individual plans over the course of 12 months, you have to do that all in literally 2.
Yes, which is very stressful right now.
Right. If you have an agent, an independent agent you're working with,
be patient with them.
Be patient with them. So what can they do to help facilitate the enrollment, the open enrollment period, which again starts November 15th? And then, so actually let's go over those dates. So you said we got a November 15th through December 15th, and that's for a January 1st effective date.
You got it. And the next one, you want to?
Yeah, sure. So then December 16th through January 15th is another open enrollment period, but that's for a February 1st effective date.
Correct.
And then the third is January 16th to February 15th, right?
Yep.
And that's for a March 1st effective date.
You got it.
And so once that closes on the 15th, then if you have not taken care of your individual plan, you are looking at the fees and the costs or the penalties associated with not having an individual plan. You're pretty much done.
That's correct, Dr. Zach. And just to reinforce that, that is the 3-month open enrollment period that the government has mandated. And
right.
So if a person doesn't have the coverage after that, you have to wait till the upcoming year in November for open enrollment.
And then, but you did say that there were a few times when enrollment could happen outside those periods, and you called those special enrollments. Do you want to go ahead and tell us what those are?
Certainly, that is correct. A special enrollment is when a person has a situation based on some key areas, and that first things first, one that loses their job, a layoff, and they had existing group coverage in that job. And then they have the opportunity to look at the individual market from there. That's one.
Okay.
Another one is if it's a child who's an adult child who's 26 and they were on their parents' plan and they have the option of looking at coverage that way. Another one is a divorce or having a child. Those are special enrollment periods as well.
Okay. So if you don't get enrolled as an individual by February 15th, the only other time that you would be able to become a special enrollee is you're an adult, you're turning 26, you were on a parent's plan,
Correct.
you've lost your group coverage because you've lost your job or you're transitioning jobs, and then you have a divorce.
That is correct.
Or you have a child in that time frame. Okay, so let's say that none of those things are happening for us in the coming year, and we need to go through this normal open enrollment process sometime between November 15th and February 16th, depending on what's going on. So how can we help our agents help us do that, considering they're going to have to process a ton of people in that time frame?
So a couple of good ways of doing it is keeping in communication with the agent, even if they're overwhelmed right now. Sending them an email, maybe just a quick call or a text, just to let them know, hey, is there anything I can do to help you? Because I hear nothing's changed in my current situation, and
Right.
that means like no change in your family status, or something like that.
Right.
So those are things that can help with your agent as they go through this major transition with all their clients at one time. And then also you can do a little research and maybe go online to the current carrier that you have, or maybe some new carriers, and see what their current plan is, or their plan options that they have, and then talk with your agent about that as well. The other thing, and again, I'd like to just extend that offer as well, is that your existing coverage that you currently have, if you do have coverage, look on the back of your ID card and you see a number for service department or member services.
Right.
Contact them and let them know that you just wanted to just get an idea of how the plans are looking for the upcoming year.
So start planning ahead for the next couple months. Don't be waiting, and because you may be sitting on hold for years. Yeah. It sounds like if you're gonna go that route. You shared 3 numbers with me, which were pretty interesting, and I wanted to throw these out here. Mm-hmm. So the first number is 300,000. Second number is 100,000, and the third number is 16,000. And
yes.
If you have not been paying attention to this industry, and of course these were new to me because I haven't, it's not really on top of my mind. Tell us about those 3 numbers and how crazy they are.
Oh, geez. And the 300,000 that Dr. Zach had mentioned earlier is what it was prior to healthcare reform. It's 300,000 health insurance agents in the nation that were focusing on health insurance as a main core of the business. Currently, right now, based on going through healthcare reform and some of the changes within the carriers and the commission structures and compensation and all those things, there is now less than 100,000 health insurance agents focusing on that area. And that what that really tells us is that a lot of agents moved out of the industry of health insurance. They may have moved into property and casualty or commercial insurance or financial. Exactly. The last number that was mentioned, 16,000, is the number of IRS agents that were hired over the last 3 years by the IRS, which basically is telling us that they are getting geared for the marketplace infusion of many enrollments that are happening, and that they are anticipating going through an auditing process for a lot of those individuals to verify if the information that they gave them to get a subsidy is true or not.
Correct. Okay. Right. So what you're saying is not only has this legislation compressed your enrollment period from 12 months into 2, you've literally seen, for every 3 guys or gals that were standing up who were insurance agents, 2 of them have sat down and are now doing something else.
Exactly.
Okay, so people need to understand that this is a incredibly underserved market in terms of there's just not a lot of people who can do the hours necessary to do the individual enrollment within the marketplace. And we're not talking about the exchange, we're just talking about the individual in the marketplace. So, and then the 16,000, if I understand right, you're talking about these, or IRS getting ready to audit, you're talking about actually people going through the exchange. So these are people who maybe aren't necessarily going to work with someone like you, but they're going to go through the healthcare.gov. And what you're saying is, if I read this right, is people need to have their documentation correct if they're not going to work with somebody like you, if they're going to go through healthcare.gov.
Yeah, they do. And not only that, they need to verify on a regular basis that documentation is correct and that it doesn't change. We talked about an example, Zach, about someone who actually they may have got a promotion, they maybe were qualified for a subsidy at this amount, and then all of a sudden they got a big promotion, and then they can, well, for whatever reason, they maybe forgot to let healthcare.gov know. Then all of a sudden they would not have qualified for a subsidy after that if the government knew that they had that increase. So we got to keep them updated on that.
Right. So if someone is, let's say they work for themselves, or they're in an industry where they get a lot of cash payments, and it's just the nature of the business. Let's say they work at a hair salon, or
Yes.
they are a waiter. Then that's a situation where they may want to go through the exchange. However, if their tax documentation isn't 100% wrapped up and great, that they're opening themselves for potential risk in terms of going through the exchange, and people probably should know that.
They should know that, Zach, because there's no doubt if the government is allocating billions or millions of dollars in subsidy money, and then they're going to want to know if that money is being really used.
Right. I mean, and I certainly don't blame them for that. All right. So I think we covered a few of the things that people really need to know about what's going on. So let's go ahead and talk about, and kind of shift from individuals and go to owners. And basically, so right now we're talking to you if you are a business owner. And you have small group coverage for your employees. And if you are an individual who gets small group coverage, you're going to want to listen to this as well, because some things have changed in the last couple of years that are definitely affecting hiring and affecting even age of workers. So we're going to go ahead and talk about that. So maybe we could talk about why a small group plan may not be beneficial for an employer. And we're looking at groups right around 2 to 20 or 2 to 50,
Yeah.
Is that right? Okay.
Yeah.
Let's put it this way. What are some cons of them keeping a group plan as opposed to sending their workers to the private marketplace to work with someone like you, or to go to the exchange?
Sure. Some of the disadvantages with small group, especially in the small market you had mentioned earlier,
Right.
Dr. Zach. First things first, the cost is becoming more cost prohibitive. If we had a chance, Dr. Zach, I'd like to give a percentage later when you're ready,
sure,
about where the increases are happening in the insurance industry.
Yeah, we should do that.
Okay, so first things first is that it's cost prohibitive. I mean, the cost is skyrocketing for a small group as well as individual. The other thing is that with group insurance now, there used to be an advantage for going into a group plan, because you couldn't, prior to healthcare reform, they didn't look at health conditions. You could get, it's guarantee issue in a group umbrella. Now individuals guarantee issue, so that issue is taken off the table.
Right.
The other thing is that with group insurance is that in the small group market, if one plan you have, everyone gets that plan that was on your program.
Right.
So that's another thing that, again, based on selection process for your products. Along with that is that there is the increase that's driving some of the cost of health coverage in the group market is traditionally you couldn't get group insurance, Doc Zach, unless you had workman's comp.
Okay.
Workers' comp is a driver in getting group insurance.
Right.
Because of the fact, if you are getting group insurance, that means that you are doing business. Those employees are doing business in your company.
Right.
And so you need workers' comp in order to make sure that you are addressing issues dealing with being injured because of the job.
Okay.
So those are some things that are some of the cons with that.
Okay. So what you're saying is the workers' comp is now being bundled, or it's a totally separate, different.
It's a
cost
requirement.
now.
It's
okay.
Workman's comp is a separate insurance package that you need to have if you want to enroll a group program. They won't do it unless you have a workers' comp a separate insurance. That's like a liability insurance for employees.
Okay. So the cost is going up for group. Workers' comp is a part of that. One of the cons of keeping the group plan is that now individuals are guaranteed, despite whatever condition they have.
Correct.
The protections that were part of the group that, let's say, that one of your employees might have, they can now get via individual insurance.
Yes.
So therefore, there may not be a benefit to keeping the group plan because of that.
Yeah.
Could you talk a little bit then about cost in terms of age and how that used to be bundled?
Certainly. Yeah.
Under a group plan, and now how it's not being bundled anymore, and what that means for employers and who they're hiring?
Yeah, it's a change because of healthcare reform. What's happening now, traditionally used to be that in a group program, you may have a person who's 42 whose price is maybe their price for their plan may be $40 or $400, and then you have a 22-year-old who's working in the same company and their price may be $200.
Right.
But then what happens in the group world, and prior to this, is that you averaged it out. They average billed based on, and so you would say a member of an employee only would be $300. So you
Right.
average it all out.
Right.
And then you have a couple would be 600 and a family would be 900, etc.
Sure.
So today's world now, it's completely different, which is another disadvantage for it in the group side, is that now it's member rated. So all the groups now have to are mandated to give a price per age for each person.
Right.
So it really puts that out there in terms of what if you have an older population or employee staff, now their ages are going to be a lot more expensive versus a younger staff. We're certainly wondering what the government's going to do about that, because we see some potential liability issues in this whole framework of looking at it that way.
Right, because if the price point per individual is now broken out based on their age, then it would seem like then you're incentivizing employers to
Exactly.
get rid of their older workers.
It's a hot issue, yeah.
Yeah, exactly. So, okay, so we talked a bit about what the cons are if you're an employer and you want to keep a group plan. Let's go ahead and talk about what some of the pros are of staying with that group plan, or what people can look forward to.
Okay.
So, yeah.
And some of the advantages of group plans. First things first, the group itself actually, because they are the owner of the policy, the group plan. That means they get their tax advantages or the write-offs for those group premiums that they pay every month.
Okay.
Regardless if there's a contribution going to that employee that's being taken out of their paycheck.
Regardless if any money goes to that employee at all, they still get to write off the cost.
You got it.
Okay.
Because it's a group plan.
Right.
The other advantage for group programs is that it gives the ability for the employer to use it as an enticer to hire new staff.
Right.
Because they have a group program that they offer to their employees and to new candidates that they may be interested in hiring.
It's good PR for the company in terms of human resources.
Certainly is, yeah. The other thing is that group programs do not have any issues when it comes to the government mandates about open enrollment periods and non-open enrollment.
Okay.
That's primarily only for the individual market at all, Doc Zach, for that open enrollment issue.
Okay.
Group insurance, group programs have the ability to hire people based on the need throughout the entire year.
Right.
As long as they meet their new hire period that they have designated for their group plan.
Right.
That's it. That's all they have to worry about.
Okay. All right.
So those are some of the advantages.
some of the benefits or pros of if you are an employer and you want to keep your group coverage, something you can look forward to is the fact that you have been able to, and you can continue to be able to write off the premiums regardless of whether or not your employees are actually using their benefits. It's a great, HR, PR, because, people come to expect that their employer is going to handle their benefits, or at least offer some sort of benefit. Of course, it is mandated for employees number of 50 and above, right?
Yeah, 50 and above, and they're still working on that, and it's still been pushed away and pushed out until 2016.
Okay, so
under 50 and under,
50
they don't
and
have
under, they don't have to, exactly. Okay,
yeah, no offer.
And then there's no forced enrollment or open enrollment period,
Correct.
so you can kind of play with your plan in terms of adding or delisting folks.
Correct.
Because of that. Okay. So those are some of the pros. You did mention some percentages that you wanted to get into, and is that relative to group or individual?
Oh, both actually.
Okay.
And
okay.
And if you get a chance, this is something that's really, we talk about what's driving the cost of healthcare.
Right.
Over the last 20 to 30 years, the cost of healthcare has been escalating for three key components, and I want to give these percentages.
Okay. Yeah.
First things first. About somewhere between 35 to 40% of the increases have been because of the cost of hospitalization.
Okay.
The cost of hospitalization is extremely expensive these days, although it's being paid by the insurance company.
Right.
But the reality is, it is
that
a
cost
major
needs
cost
to be forwarded onto the customer.
Now, here's another one that's really very sizable as well. Another 40%, 35 to 40%.
Okay.
Is also because of drugs. Pharmaceutical companies are making record profits every year. It's unbelievable.
Right.
The statistic I just read just this week that they invested over $88 million in advertising just for pharmaceutical companies.
Right.
$88 million.
Okay.
So that is another part that's really driving the cost of healthcare.
Okay.
The last thing, which is about 10 to 15%, is lifestyle.
Right.
We as a country, we look at obesity as an issue.
Right.
Childhood diabetes, obesity is an issue.
Okay.
Smokers, excessive health lifestyle issues.
Right.
And so these are things that we need to take a good look at in terms of how we educate the citizens in the United States here.
Right.
But not only that, how do we get help from the government to understand that these other components, drugs,
Right.
the pharmaceutical industry, and also the cost of healthcare, how do we address this issue? Another thing, lastly, and I was going to say this at the end, education.
Right.
Because Dr. Zach, you invested several years in dollars as a medical doctor.
Well, chiropractor.
Well,
right. But within that framework, yes.
So you can imagine for medical doctors who are specializing in all different fields, the cost of education versus a person who just goes to get a bachelor's degree or a master's degree is extremely sizable in terms of the difference.
Absolutely.
And
right.
you and I both know.
Yeah.
They don't go. No one's going to go and be a doctor.
Right.
And invest $250,000, $500,000, $1 million in their education over a time period.
Right.
And not think that they're going to get their recoup their money back.
Right. Exactly. Yeah, and that's a major issue as well, and it's really interesting, and most people don't know this. There is the reality that for a lot of folks who practice medicine, they spend a lot of time, a lot of energy, a lot of money. They go through a weeding process. Yes. It's incredibly intense, and people who make it through that and they become successful, they deserve the accolades and kudos to them. But because the cost of that education is so high, the basic level health provisions that our country needs, people are choosing to not go into those fields. So your average, your average pediatrician, your average just family health doctor, just the small country doctor, that kind of old school, kind of doctoring that really that's what most people need. Doctors are choosing not to go into that. They're choosing to go into highly specialized, very high cost, very lucrative fields. Why? Because they have to recoup 8 to 10 years of their life at least. And then in addition to that, the cost of education, $250,000, $300,000. But not only that, the time that they spent where they were not making any money. Here I am, I'm spending 10 years and I'm dedicating my life to what I believe is a service and noble profession. And I'm watching my peers get into tech or get into, get into entrepreneurship and, making 5 times, what I'm going to make when as a resident or intern. And so the opportunity costs for someone going into medicine right now are just so huge. They have to make that up somehow. And they're either going to not participate, or they're going to make them up somehow, and they're going to do that via specialties, and then that kind of filters on down to people, let's say, getting more specialty medical services when they could literally go to someone like me, and spend 10% of that cost in terms of the service. You were going to mention, I want to share this with people, but first, before you get into your prescription card, tell us how people can get a hold of you if they want to ask you some questions. And we know that you're going to be slammed and you've got a lot of stuff going on because you have a 2-month open enrollment period that you need to service your current clients with. But if someone wants to get a hold of you and ask you questions further regarding these issues, what's a good way for them to reach you?
Certainly. If you don't mind, if you let us know that you heard this from Dr. Zachary Ward, that would greatly appreciate it. But you can call my cell directly. I would like to field those calls as they come in, if there's a need for that. It's 248 area code 217-3046. Let me repeat that again, please. 248 area code 217-3046. I also have a website. It's www.premiersolutions with an S agency.com.
So PREM, I believe IER Solutions, SOLUTIONS agency AGENCY.com.
You got it,
okay.
Dr. Zach.
All right. So I can spell. So what is the big secret in terms of trying to control healthcare costs that people need to realize if they're going to go the medical prescription drug route?
Okay, and this is something I want to keep it short, but it's really powerful. And most of the clients have come back and said, this was so good. Thank you. I've cut some costs considerably. First things first on the drug cards. If we remember, if you can see, if you look out your front door at home or at work, you'll see on the corner of every street a drugstore.
Correct.
And the drugstores are not making profit off the milk. They're making profit off the drugs. And so what I would share with you is that one of the key pharmacies that has been very cost effective in offering affordable drugs in this state of Michigan is Costco's. Costco's has been very successful in doing that, and the other reason why I'm sharing that with you is because it's open to the pharmacy. It's open to the public. The pharmacy is open to the public. You don't need a membership there. Now, here's an example of that. I know a client who was taking a high blood pressure medication, and they were getting it at CVS, and they were paying it out of pocket. And there's a reason why I'm telling you this as well. They were paying out of pocket, and there was a generic drug. It was $38 for a 30-day supply. They went to Costco's. That same drug was $9.16 for a 90-day supply.
Right.
And so if you have an opportunity, it's very important for us now to manage as much as we can our costs and the expenditures in our healthcare. It's up to us now. We can't depend on the insurance companies. We can't depend on the hospitalization. We can't depend on the drug companies. That's for sure. So it's really up to us to identify how we can manage our cost. So what if I suggest to you is that if you have a drug card today and you have a copay, it'll be very important that you ask your pharmacy before you run the drug, before you run your card, how much is the cost of the med without insurance. That's very important, ladies and gentlemen. Ask them how much is the cost of the drug without your insurance. Because literally, ladies and gentlemen, if you have a $20 copay for a generic drug on your insurance card and the cost of the drug is $9, the drugstore is obligated and contracted to run you through the system and pay and ask for your $20, even though the cost of the drug was $9.
Correct.
So if we can all start doing that, and it's almost about it's about saying how much first before you even do anything with your drugs, and quite frankly, you might want to start doing that with any kind of procedures that you're looking for as well, and start shopping around, making sure because the cost of hospitalization is changing. And every hospital facility, whether it's Beaumont, Henry Ford, Providence, Botsford, St. Joe, all of them have different rate structures. So it's up to us to start managing that process, because at the end of the day, we're the one paying for it. If I can help you not pay a claim or run a claim, but reduce your costs in your drugs, then that's what we just did.
Right. Yeah, and it's such a large topic.
Yes, it is.
And it confuses so many. So I think this is going to be very, very, helpful, and hopefully you got some value out of that. If I could just interject in terms of health savings and cost, just so you know, if you want to pay cash out of pocket for a lot of, in a lot of places that run labs, getting your vitamin D levels checked costs about $100. The actual supplementation to raise those levels is relatively cheap. What we've seen from the literature on vitamin D and its effectiveness at this time of year in terms of helping out with flu season, just a simple low-cost way of helping to feed and support your body and prevent those illnesses that might wind up, especially for some populations, in a hospitalization. That would, be pretty expensive, and may or may not get, all the coverage and all that kind of stuff that you might want. So, okay. So if you like this, give me some feedback. I'd love to know that you listened to it and you heard it. You can shoot me an email at that's the letter Z, zebra, letter Z at drzacharyward.com. That's DRZACHARYWARD.com. Or you can also call my office line, 248-598-4002. Let me know that you listened to it and how much you liked it. And, of course, you are welcome to get in contact with Mr. Cedric McSween if you have any other further questions. And, again, that is PremierSolutionsAgency.com. And one more time with yourself.
248 area code 217-30.